Thanks very much for joining us for today's webinar. As you can see, I'm not Danny. My name's Charlotte Cork, and I'm a product manager on Simply People. So I'm working closely with Danny, who's the founder that some of you may already know. Just to very quickly tell you a little bit about Simply People, we're connecting a community to improve physical and mental health and well-being of employees across the workplace. And we're the fastest growing occupational health and well-being community in the UK. We help organisations who need occupational health services to find the right provider first time. And for employees who are unsure of exactly what they need, we offer a free independent triage service to help them navigate the territory. Supporting occupational health providers is also a key part of what we do by providing a range of support for the provider community, including lead generation, skills development, and of course by hosting events just like this. So today on International Women's Day, we're hosting a progressing to an inclusive approach to supporting women at work. And just before we start, a few housekeeping notes. If you have any questions during the presentation, please type them into the question box in the GoToWebinar control panel, and then Emma will curate those at the end, and we'll have a Q&A session at the end of the presentation. So today's session, we've got very delighted to be joined by Emma Persand and Dr. Anise Mukherjee. So Dr. Anise is a physician, endocrinologist, and author of the best-selling book, The Complete Guide to the Menopause. And she'll be discussing the biological and self-management aspects of menopause transition. She supported thousands of women going through menopause to help them manage symptoms and improve quality of life. Emma Persand is a qualified nurse, workplace health and wellbeing professional, and founder of Workplace with the Menopause. And she'll be discussing the cultural and societal influences on women's health outcomes. Her company delivers education, awareness, and management duty of care training to promote equity for all in the workplace, and works with organisations in their commitment to support and retain their female talent. So without further ado, I'll pass over to Emma, who will introduce the session.
Hi everyone, can everybody hear me? Because I can't see anybody. So is my slide there with me waving on? Yeah. Okay. So I'm going to jump into this because we've only got an hour today and we're going to cover a lot of ground. So I've been introduced. It is International Women's Day. And so the theme this year is Choose to Challenge. And I'm going to choose everybody that's listening today I'm going to challenge everybody that's listening today to think about reproductive health, and is it ever spoken about, managed, signposted in your workplace? And if it isn't, my challenge to you is to start normalizing reproductive health. So to start off, this is a quote I used in Workplace Wellbeing pre-COVID, when we knew that we needed to support women at work. Women need to be empowered to get support for their health through greater recognition of conditions and ensuring parity alongside other workplace health issues. Now, I'm talking about equality and diversity today, and of course this can be applied to men's mental health, ethnic and diverse issues in the workplace. But today, because it's International Women's Day, we're focusing on women's health. Okay, I'm going to speak for the next few minutes on what it is to be a woman, and what all the factors that influence us to make us who we are today. So there are obviously biological, psychological, social, including the workplace, ethnicity and culture that can influence how a woman is today, how she's perceived in society, and how she perceives herself. Reproductive health, endometriosis, these are all the things, the conditions that I've come across as a workplace occupational health and well-being professional, that I manage these women in the workplace. So it's endometriosis. 1 in 10 women suffer with endometriosis. There was an all-party parliamentary group report that came out in 2020, and it looked at the landscape. It interviewed 10,000 women on their condition. It found that it took 8 years for a woman to receive a diagnosis. She was obviously passed from pillar to post, seeing bowel specialists before an endometriosis specialist. She was likely to have attended A&E. 54% of them attended A&E, and they were likely to have attended more than 3 times before they were referred on. It's 1.7 million working women suffer with endometriosis. So this parliamentary group has called for, there's more women with endometriosis than there are with type 1 diabetes in the workplace. And it's called for a parity, more education for women and GPs and healthcare practitioners to start recognising the signs and symptoms of endometriosis. The same as polycystic ovary syndrome, PMDD. Now this is premenstrual dysphoric disorder. It's a condition that it's like a severe form of premenstrual syndrome requiring intervention and support. It has recently been classed as a mental health condition. It was previously as an endocrine condition, but now the DSM-5 has recognised it as a mental health condition. There's still lack of information and support for these women. Infertility, miscarriage, stillborn, cancer. There are 5 gynecological cancers. I've put pregnancy and menopause in italics because of course they're not illnesses, they're not conditions that need to be managed, but because we do not acknowledge them and there is lack of information and proper support, we do need to highlight them and therefore speak about them as if they are an issue that can be addressed. Okay. Biological sex is what we are born with. The gender that we identify with are made up of traits and characteristics of what a society perceives as what a normal woman is or what a normal man is. So all these things add up to how a woman is perceived in society and how we perceive ourselves, its attitudes and beliefs. And what is represented, how this is represented is through the social learning theory. A woman or a man gains or learns what it is to be that person by watching their peers, by watching their family, by seeing what's on the television, in the media or online, and we learn what it is, if you like, to be a normal woman. And this is our attitudes and beliefs. Unfortunately, because reproductive health is not spoken about and is rarely acknowledged in any programme, women menstruating, women go through the menopause, reproductive health is a silence to it. This adds to mental health. The stress, HSC did a survey in 2017, and across all ages in the workplace, women suffer more work-related stress. Now, these attitudes and beliefs from our society are also our workplace. Who's represented in the workplace? How are women perceived? How is women's health addressed? There's something called the care burden. Women take on more of the caring, the elder care and the childcare, as well as holding down their job, and unpaid work. It's called unencumbered work. There was an Australian study that looked at the chronic health outcomes and the risk, the potential for you to develop a chronic illness. Between men and women, there was no difference. Young men and women, they have the same level of risk and the same outcomes. As soon as a woman got married and as soon as a woman had a child, those risks for a woman started to increase, even though she may have been working. So it's talking about the whole woman as looking at the whole woman, not just what she's doing at work, but what she's doing at home. She's more likely to do the housework, and there's lots of statistics on that. The type of employment that a woman does, we have gender assigned occupations. So we have great initiatives to get more females into engineering. We have great initiatives to get more men into nursing, because we recognise that if you have an inclusive workplace, you're more likely to be successful and productive. The working conditions, gender pay gap, all these issues that are in the workplace that we are looking to address, and it starts with talking about what it is to be a woman. Ethnicity and culture, attitudes, beliefs. COVID has shone a spotlight on all these inequalities and this disparity of outcomes, where you live, what colour your skin, your gender, your biological sex, how much money you earn, have all been implicated in how well you recover or develop a severity of a disease of COVID. Structural racism and perceived racism has been indicated as one of the factors in the workplace, in the NHS and the wider society, that has influenced these appalling outcomes. So, with all that, we're going to focus on menopause today. And I'm pleased to hand over my screen now to Dr. Anise Mukherjee, and she will tell you about her work. All right, just bear with me of IT. Hold on. Okay. Okay.
Okay. Oh, can everybody hear me and see me? Yeah. Okay, and the volume's okay. Great, lovely. All right, I will carry on then. So thank you very much for the introduction. I will just so my name's Dr. Anise Mukherjee, and yeah, I'm absolutely delighted to be part of this session on International Women's Day. And I'm supporting the Choose to Challenge campaign, and I want to challenge perceptions about women's health at work. So I'm going to talk about my experience as a clinician. So as Emma has very eloquently outlined, we need to think about women's health today differently, because it is different today. There are, as she's mentioned, some biological, social, cultural and environmental factors that are present in today's world that were just not present even a couple or 3 decades ago. So things are different, and there are unique life challenges for women today compared with every other previous generation. There's more demands, there's more stress. Women are often described as the sandwich generation for the reasons Emma has described. And it's also important to say that women can expect to have more adult life after menopause than they had before it, because we're living so much longer. And this is, partly the reason that the number of employed women in the UK between the ages of 50 and 64 has risen by about 50% in the last 30 years. So this is a workplace demographic that we need to be thinking about, and we need to be thinking differently. So it's important to raise awareness. So as a clinician, one of the things that I often notice is that the terminology that's bandied around isn't always understood. There are some natural hormone phases in life, and there are some hormone imbalances and conditions. And many women at any one point working in the workplace will be experiencing issues around either natural hormone phases of their life or hormone illnesses or diseases. So let me just talk a little bit about terminology. So I'm going to go through the natural hormone phases, just to be clear. So premenopause is the stage in life that's describing a woman's fertile years. So it's from once she's gone through puberty and starts to have a regular menstrual cycle all the way through to menopause. And actually women who are premenopausal, whilst they're in that phase of life where they're fertile, they can suffer from many hormone problems and imbalances, which Emma has also outlined. Pregnancy is something that is very well publicised in the workplace and generally well supported. But the postpartum period after a woman's given birth can also be subject to quite a lot of hormone imbalances, and that's an area that's not so well supported in general. And then later on, as a woman gets a little bit older, she may go into something that we describe as the perimenopause, which is the phase where hormones start to fluctuate and be a little bit imbalanced. It's a very natural phase, but it can result in hormone fluctuations that can last from a few months to several years. It's very common after the age of 45. It can cause quite a lot of symptoms. And it's important to note that periods during this phase can be normal or feel normal, and a woman may still be fertile, but she may be experiencing symptoms, and she may not associate those symptoms with perimenopause. So again, raising awareness is important. So as the hormones then progress further, the menopause is the time when periods stop. Meno is periods and pause means stop. So that's exactly what it means. And the average age in the UK is 51. It does vary from country to country. About 1% of women will go through menopause before the age of 40, and that's classed as premature ovarian insufficiency. And that is treated differently to women who go into menopause at a natural age, because women should be seeing estrogen in their younger years, and if they don't, that can have an impact on things like bone health and heart and cardiovascular health. So it's important to know that if a woman has symptoms at a younger age, she should be checked out. And it shouldn't just be assumed that if she's under 40 and has symptoms and perhaps her periods are irregular, that it couldn't possibly be menopause, because it can be. So when menopause appears, about 70 to 80% of women will experience some symptoms. And I'll go over those, what the symptoms are, in a minute. But it's thought that about 25% of women will experience from quite severe symptoms and may need support, either from her healthcare provider and possibly from her employer. But it's also important to be aware that symptoms do spontaneously improve over a number of years, but it's every single woman's experience is different, so I can't say in any one individual exactly how long that's going to be. And then the post-menopause is described as the phase in life after a woman has had no natural menstrual periods for 12 consecutive months. So we've talked about this earlier in the talk, but the terminology is also important for other hormone-related health problems. So Emma's described premenstrual syndrome. It's also described as PMT, PMS, and then the more severe form, which is PMDD, which is a premenstrual dysphoric disorder, which has endocrine and mental health consequences. Polycystic ovarian syndrome is a common condition in women from puberty right the way through their lives. Premature ovarian insufficiency, as I said, can affect small numbers of women, but this is very important to recognise. Many women are going through fertility treatment or having problems with infertility whilst they're at work, and this does need to be recognised. And we need to be aware that, and this is a wonderful thing about where we are today, is that many people now today are surviving cancer long term. And the cohort of long-term survivors of various different cancer treatments frequently have hormone consequences. And this is actually a medical field known as late effects of cancer therapy. And I've done a lot of work in this area. And this is a growing cohort that have survived all different types of cancer, but the treatments they've had for their cancer, which may be radiotherapy or chemotherapy or other medical therapies, there's immune therapies now, these can all cause hormone consequences. And many of these women are in the workplace, and so they should be, but we need to recognise that they may be living with a burden of other health issues related to women's health issues specifically. And Emma's already talked in detail about endometriosis, which is a much poorly understood condition, and we need to raise more awareness about that. So raising awareness is really clearly agreed now to be a priority, and I was delighted to see only in the last couple of days that the government has launched a call for evidence to improve health and well-being of women in England, and this was timed to merge with today's International Women's Day, and I'm going to support this in every way I can, and it's very clear that there is a need for this, and it's good that it's being taken forward by the government. So just focusing specifically on menopause at work now, because it is a problem. And why is it a problem? Well, women over the age of 50 represent the fastest growing demographic in the workplace. And there are over 4.4 million women employed in the UK between the ages of 45 and 60. And around 2 million women aged over 50 in the UK have experienced difficulties at work due to their menopause symptoms. And it's important for us to be aware of this, because menopause symptoms do usually settle over time, and with the right action, it should not, or it should only slightly impact on work roles. So taking the right action, whether it's from an individual, from a healthcare provider, or from an employer or a colleague, it's really important. And it's a little bit like sliding doors. We know that research has linked the severity of menopause symptoms with women intending to leave employment, but understanding it through wider society, not just the woman understanding it, but everyone around her understanding it, changes the narrative. So it's not like it's inevitable that menopause is going to come and cause problems. We can change that. So understanding the cause of symptoms is crucial, because a woman can then start to take control, to take the right action, or where necessary, obtain the right support. And support in the workplace will facilitate retention and career progression. And this ultimately will help to restore gender balance in leadership roles. This is something that really urgently needs to be addressed. So these are so important. All these factors are very important. So where do you start? What do you do if hormone symptoms are affecting work? So I'm going to talk to the woman in the next couple of slides about this, and about what you can do for yourself. And then we'll move on to when help is needed beyond what you can do for yourself, and then the workplace. So, as I said before, awareness is massively key. Awareness from everyone, from the woman herself, but from younger women. Preparing for and being aware of what might happen will enable it to be recognised. Communication is important, because if a woman is experiencing symptoms, she needs to be able to communicate that with those around her, and that will help if action is required, whether it be a woman taking action herself or seeking help for symptoms. But it's also really crucial for us all to be aware that every single woman is different, and the individual support that may be needed by one woman will be different from another woman, even if those women have the same condition and similar work roles. So, and that's something that really needs to be, amplified and aware in the workplace from line managers and employers as well. So what common hormone symptoms might impact on work? And I've done a list here, and it's a short list, and actually there are many, many different symptoms that can impact on a woman's work role when she's starting to develop symptoms in the menopause. So that the most notorious symptoms are the hot flushes and sweats, which are really well publicised. But other things like sleep disturbance, flushes and sweats can occur at night, and actually insomnia can occur even in the absence of those. And that can result in a knock-on effect of fatigue during the day, which can impact on focus at work. Mood changes are very common in today's cohort of women going through the menopause. It can be low mood, anxiety, irritability, and brain fog, all of which you can clearly see could potentially impact on performance at work. Weight changes are a really common problem in today's world, and it's clear that menopause metabolism results in the fact that you can eat the same food that you've eaten all your adult life, but suddenly you start to notice more weight going on in a little bit of a central distribution around the middle, and that can affect a woman's confidence. And then other symptoms such as headaches and migraines, which often start to become problematic in the perimenopause when hormones are fluctuating a lot. Similar for heavy periods, as the hormones are peaking and troughing before menopause becomes established, and heavy periods can be a consequence, and even anemia, and these can impact on work. And also, as hormones change, the bladder and the pelvic floor can be affected. Women can experience symptoms down there, including water infections, and that can impact on symptoms and on work. And other symptoms such as muscular aches and pains. There are many different symptoms, and I'm not trying to summarise all of them in this slide, but it's just to give you a flavour of what can occur. And some women will get very few symptoms. So the next section is about how we reduce the impact of menopausal symptoms at work. And I think it's threefold. I think there's a role for the individual to take. There's a role potentially for the healthcare provider. I'd like to see that as a bigger role going forward to help women prepare for the menopause. And then there's a role for the employer. And I'm going to talk a little bit about these over the next few slides. But it's my opportunity to share with you my book, which was just published on the 28th of January, and it's called The Complete Guide to the Menopause, and it basically covers all of these. It covers a toolkit that can be implemented right away and easily for every individual woman to tailor to her own needs. It has been very popular with my colleagues who are healthcare professionals, who feel that it's helped them to help their patients and understand menopause better. And there's a section on employment, which Emma Passand helped me to write, and it's an excellent chapter which will help if an employer wants to read about the menopause and support their workforce. So please do consider reading the book to gain more information in this area. So I'll say a few words on self-management, and I think it's important because actually these are questions that I often get asked, and so there's just a couple of slides on simple things that a woman can do for herself, and that's not the whole story. There's a role for the healthcare the employer as well, and from the healthcare professionals, but this is what a woman can do for herself. So simple things can make a very big difference in the workplace. So hot flushes and sweats are the biggest symptom and problem that's described by women. So simply wearing layers of clothing, preferably cotton and natural fibres, but avoid wool, silk or synthetic fabrics which tend to retain heat and cause worse symptoms. And layers of clothing so that as the heat starts to emerge with a flush or a sweat, you can take off outer layers quickly and cool down quickly. Things like desk fans and, where possible, obviously climate control in the workplace in larger employers can be really helpful. And it's not a myth that spicy food and hot coffee can bring on a sweat. They absolutely can and do. So avoiding spicy food and having iced tea rather than hot coffee can make a big difference at work. For fatigue's a common symptom in the menopause, and things like missing breakfast can really make it more difficult to function at work, especially in the morning if you haven't had breakfast. So having breakfast can make a big difference, and then getting a little bit of fresh air during your lunch break. A lot of people say, I work through my lunch break, I don't want to have a break, but actually a short brief burst of exercise at lunchtime, getting some fresh air, a little bit of exercise, can boost all the sort of, hormones that are affecting your stress levels from your adrenal glands, and they actually help boost productivity in the afternoon and help your alertness in the afternoon. So it can be a false economy to say I'm just going to work and work and work for hours on end without a break, because your productivity reduces. Flexible working and working from home can sometimes be supported by employers. Of course, one spin-off of the pandemic is that many people are being facilitated to work from home sometimes or more of the time, and that can help in this context with symptoms like fatigue during menopause. Things like it will avoid the commute to work and things like that. And then for insomnia, which is a really common problem, one thing I always say is that, and whether or not you can do anything about it, being aware about it is important. Shift patterns, constantly changing shift patterns, are really problematic for people with insomnia, particularly in menopause. So women who will be doing an early shift, a late shift, a night shift, and alternating every few days, their body clocks are malaligned, their circadian rhythms are disrupted. And so if shift patterns can be smoothed out so that you're doing more of one particular type of shift, whether it be a day shift or a night shift, that will allow the circadian rhythm to get into a better phase. So otherwise, constantly changing shift patterns is a little bit like having jet lag and can cause really major problems with insomnia, fatigue, and generally keeping a routine, a day-night routine, is helpful for insomnia. So other things that you can you can do things for yourself to help. So for low mood, stress and anxiety, exercise, movement. Some people think, oh, I don't want to do exercise, but just any movement, and a brisk walk is as good as anything else. You don't have to be doing amazing 10k runs or marathons. A brisk walk is proven to be really beneficial for many aspects of life and help with boosting mood and reducing stress. Trying not to be overcommitted is really important for stress, anxiety and mood. So, planning your work and your deadlines can make a big difference. And again, flexible working can sometimes help, but may or may not be supported by employers. So brain fog is a symptom that many women experience in menopause. It's not unique to menopause. It's associated with stress, and it can occur in other situations, and it can occur in men as well. But with brain fog, again, planning your day, avoiding being too stressed can be really helpful. Last minute deadlines are problematic for this. Preparation and not rushing. But sometimes just taking a vitamin and mineral supplement can actually help with brain fog, because B vitamin deficiencies can worsen brain fog. And so taking a B vitamin with zinc, you might have heard of Berocca, which is, I think they describe it as energy boost, which it often makes people feel more energized. So taking a supplement, whilst you might not feel you need a supplement generally in your diet, this can help with some of these symptoms. Just over the counter, nothing dramatic. And then for headaches and migraines that I said do tend to occur in the perimenopause and as hormones are fluctuating, you need to sort of think about specific triggers. Are there any specific triggers other than your hormones? So stress will trigger migraines, certain foods, sometimes alcohol, too much screen time, too much caffeine. There's lots of things that you can, if you think about it, you can identify that and address that will reduce the risk of you developing those symptoms. So that's some simple things that you can do as an individual that can help with your overall well-being and hormone imbalance. But what happens when self-management, or if self-management is not enough? And sometimes it's not enough. For most women, self-management will be really hugely beneficial, but when it's not, it is important to involve your healthcare professional, and for most women that will be your general practitioner. And that's important because if symptoms are severe, we do need to make sure that there aren't other factors at play, like anemia or a thyroid problem or something else that could be contributing to your symptoms. And so if you see your doctor, you may need some additional tests and you may need some treatment. So I would like to see much better provision for women to be able to access their GP and get good women's health support for these types of symptoms. So what else can be done? Well, we've talked about breaking down the taboo, and I think breaking down the taboo about hormone imbalances and hormone issues in women, and also in particular menopause, is needed. And we can do this by raising awareness across society. It's not just about individual women, this is about the whole of our society. And we certainly do need to create menopause friendly workplaces, because it's the responsibility of everyone to improve women's health and well-being in the workplace. So I think now what I'd like to do is just pass back to Emma to talk a little bit more about what can be done at work to support women going through menopause and other women's health issues. Oh, okay, so, right, I need to share my screen. Oh, sorry.
It's okay, I've just done that, Anise. I think you should be presenting.
Brilliant.
Yeah. No worries.
Okay.
Sorry, am I still? I'm trying to.
No,
it's all good, I think.
Is that all good?
It's all good.
Right.
Yeah. Okay, thank you, Dr. Anise, for that. So my work is concentrating on the inclusive workplace agenda to incorporate all employees. And I know we're talking about women here. I'm talking about people who menstruate, so that is someone who is identifies as female at birth, so biological sex, but also there are trans men that may menstruate after they've transitioned. There's also the trans female that will be suffering from hormonal issues, as discussed, through their taking taking hormonal supplements that may create some of these symptoms that we're talking about. So to include all women, it's to include everybody in the workplace. So a few years ago, I'd say about 3 or 4 years ago, I used to try and do these talks, and I'd get 3 or 4 people in the room, and predominantly it was women absolutely desperate, looking for some information or some support. It was women of a certain age. So then this report came out, and it really helped me raise the profile, because it was a government report. It looked at hundreds of different research, and it came up with recommendations. Well, it said initially, it says, is there an issue? And it came out when it came out, and these are the results. Okay, so the results found that less than 20% of respondents said that their workplace provided information about the menopause. So it said every woman will go through the menopause transition, and 25% will have symptoms that will significantly affect their health and well-being. So that was 25% of women that were suffering, that were unable to get any support, not just from work, but their healthcare practitioners and the wider society, because menopause was just not spoken about. 3 out of 4 women experienced hot flushes. 50% of women said work was more challenging. 47% of women did not tell managers why they needed a day off. 25% had considered quitting their job. The workplace can support or make things worse. So basically what it said was the menopause can cause issues for the workplace, and the workplace can cause issues for menopausal symptoms if not managed. 10.2% said their workplace had a menopause policy and guidance. 77% wanted more information about menopause at work. So that helped my work, if you like. People started to seek me out. People who were interested in supporting and retaining female talent started to seek me out, and my work has grown since then. There are some fantastic organisations doing brilliant things now. There's a council down in London that's won an award for their work with the menopause. It's brilliant. It is changing. So the top six symptoms that this report stated sort of echoes what Dr. Anise has just said. Fatigue, hot flushes, difficulty concentrating, anxiety, worry, insomnia, and problems with recall. As an occupational health practitioner, I can guarantee that yes, I will have seen women in my case management, and they would be experiencing all this. But there was some other research that came out at a similar time, and it was basically looked at the symptoms of the menopause and the symptoms of work-related stress. Because women had a high level of work-related stress, was it the menopause or was it work-related stress? And the report came out and said they were so interlinked, so complex, due to what it is to be a woman today, more likely to be working, more likely to have elder care, more likely to have childcare, more likely to have financial issues round about the transition age, that it was very difficult to distinguish what was causing these issues. So basically, yes, you're right. If you look at all these, this could be stress, and workplaces and women and healthcare practitioners were more likely to attribute these symptoms to stress rather than something else, and this prevented women from seeking further support. The top 7 workplace factors influencing severity of symptoms: high temperature, poor ventilation, humidity, no access to quiet area space, dryness, lack of light, and noise issues. Unfortunately, if a woman does suffer with a fluctuating of temperature, you can see the woman, she's either sat there with a coat on and gloves on when everybody else is in a t-shirt, or she's opening the window and she's fanning herself. I also conducted focus groups around all that time to do my own research, so I could inform my own practice and develop my own training courses. And I won't read all these out, but these are some of the views, and I've put in bold something that stayed with me and continues to stay with me. The psychological symptoms of the menopause can be less credible than the psychological symptoms of a bereavement. And this was one particular group, and the woman suggested this into the group, and the rest of the group agreed. And they said they felt that if they went to their manager and said they were really suffering with brain fog, fatigue, insomnia, and they thought it was menopause transition related, they would rather have gone and said that somebody had died, because they felt that they would be listened to and believed more. And also in my work, I obviously know all the evidence base, what can help, what can't help, who to signpost you towards. I found that self-help strategies and lifestyle choices that can influence severity of symptoms were not identified or discussed. Dr. Anise has just gone through some of the self-help strategies, but women themselves are not aware that they can do things to actually improve their health. Okay, so what's the best recommendations? As I said before, positive representation. We grow up and we develop a sense of ourself and our attitudes and our beliefs based on society's ideology, society's ideological values of what it is to be a male, what it is to be a female. So in your Choose to Challenge this year, I want you to think about how is inclusion and diversity represented in your workplace? How many women, ethnically diverse, neurodiverse, LGBTIQ, disabled employees are senior leaders on the board, heads of charities or public bodies? How many women, when you're watching the news or watching an expert, are they, are they female? Are they transgender? Are they neurodiverse? Well, you might not understand if they were neurodiverse, but are they deaf? Do they need a wheelchair to move about? And if you start to look at who is telling us, who is explaining to us, who are the experts, it is one ideological. It's an able-bodied, predominantly white and predominantly male. So given that all women menstruate, some get pregnant, and all will experience the menopause transition, how is women's health discussed, managed or signposted in the workplace? In the absence of adequate role models and being included, groups are set up to provide support and listen. And there's some great groups across the country. There's some wonderful menopause cafes. It's an initiative that was set up in Scotland and it has grown nationally. It is a website and you can sign up and have your own menopause cafe. There's some in the NHS, there's some in workplaces that I visited. And it is a chance and a room, a safe space for women to start discussing what helps them, what doesn't help them. There is a cost of doing nothing. So of course, when I'm speaking to, I mean, like you've all signed up for this, so we realise that you have an interest in women's health and supporting women's health in the workplace, but you can imagine there's a lot of people, including women, that don't recognise you do need gender-specific policies, standards and procedures. The obvious is disengagement from productivity, from the corporate goals, presenteeism, attrition, and also employment tribunals. There have been 2 legal cases related to discrimination. The first one was BT, Marchant versus BT in 2012. The woman in question had suffered with menopausal symptoms and was under her GP and had a fantastic GP. The GP had written a fit note, and if you know what fit notes are, they're recommendations by the GP to support somebody back in the workplace. And the GP made some recommendations that her work should be adapted ever so slightly because she was suffering with insomnia due to some of the conditions and fatigue and lack of concentration. The manager didn't take on board the fit note because he decided that his wife had sailed through the menopause, so it was nothing to write home about, so she didn't need those adaptations. BT actually have some policies and procedures in place to support women, but because the manager had acted how he did, BT was culpable. And so that BT ended up losing to a case of age discrimination due to menopausal symptoms. The second case was in Scotland, a Scottish clerk in the courts. She also had been under her GP for a long period of time, was on medication to help and support her through the workplace. She did suffer with some genital urinary problems, which was when she was peeing, and she was on some medication that required dissolving in water and change the water colour. And what had happened on this day in question was she had her glass of water on her desk and a barrister came along and picked up her bottle of water and started to drink from it. The woman got flustered and said, "That drink is my medication." The barrister then lost his temper and felt that he was drinking women's hormones. He was going to grow breasts, and what had she done to him? And he went on to lose the court case that day. He put in a complaint in, and on investigation, she was sacked for being malicious because the water that he drank was clear. And they said she knew there was no medication in that water because her medication changed colour. It went to employment tribunal and they lost. because the GP had said this woman had been on medication for a long period of time. She had suffered with menopausal symptoms. She had been proactive. She was maintaining her medication regime, and she was seeking further support. Because she was flustered and because of her symptoms, it was conceivable that she did not know what he was drinking at that time, and the fuss that was created caused a great distress. Because she had long-term symptoms that required medication and support, the court deemed her menopausal transition as a disability. Now, we all know that only a court can say what's a disability and what isn't, but they suggested that her symptoms were severe and her medication was needed, that her menopause symptoms were classed as a disability, and therefore her workplace should have taken that into consideration during the investigation, so they lost. So levels of intervention, exactly what Dr. Anise started with. Levels of intervention in the workplace don't cost anything. No intervention, it can be self-directed, where the woman goes and finds out her own information. It can be where the manager takes some time to find out some information. It's not for women to educate people on their health. It's up for everybody else to know about their health, about what's going on. Support groups. Support groups are great in the workplace. They act as a community. It's a bit like an antenatal class where you all join together and you get some sort of commonality, and the symptoms lessen because you don't feel so isolated and alone. Access to counselling or self-referral. If you have an EAP, that it is women specific, that it can talk about reproductive health issues. It's not just about mental health. Of course, mental health is the umbrella, but women's reproductive health may be a bit more specialist. Discussion with the manager and a risk assessment completed. Under the Health and Safety at Work Act, you have a duty of care to protect your employees against any hazards in the workplace and reduce and control those risks. As we've found out, that some of the environment can impact a woman's health, and also the culture, the silence can in fact impact a woman's health. So if you can go down the route of looking at a risk assessment, and what I use is the Royal College of Nursing risk assessment, and I send that out to managers. Managers and women complete it together because it acts as a prompt of all the different working conditions that may impact. And it at the very least, it opens a conversation, it makes it normal. If once you've had that conversation with the woman, you don't have to formalize it, but if you've had that conversation and you realize actually this requires a little bit more because there is an impact to health here, it's not just making the situation or the environment okay, there is an impact to health. If you have access to an occupational health, you would do a referral into occupational health. Similarly, the EAP. Occupational health and HR should be equipped to signpost for further support, a bit like mental health. Review that risk assessment and then close it. And you know, at that short period of time when that woman needed support, like Dr. Anise says, it doesn't last forever, that you supported them, they were able to stay in work and they were able to maintain their health and well-being. Regular one-to-ones go far. Regular one-to-ones and just checking in, normalizing the conversation. Are you all right? Is there anything else? How's it going? And it gives you listen to the woman. Okay, so this is best practice. So looking at the two legal cases, it came up that because that was only those two cases, and that more and more are coming, there were, the Equality Act, the more and more things are coming. This is what lawyers have recommended as best practice. So you provide an accessible policy and/or management guide at the very least. You include menopause or women's health, reproductive health, like we've been saying, in your well-being conversations. You educate all key personnel. You conduct a risk assessment to identify hazards that can be reduced. You involve occupational health. You can implement the reasonable adjustment plans. It may be nothing, it may be a small thing. It may be saying to somebody, right, okay, you can attend your meetings, online. You don't have to come in. I know this is the whole workplace has changed since I originally started this working, and women there is more flexible workplace arrangements now. However, all the research is coming out is to say that the women have been disproportionately affected by the pandemic restrictions. with the homeschooling and the elder care and the childcare and still maintaining the workplace, it has taken its toll on women's mental health. So we are, as we come out of restrictions, there may need to be more focus on supporting women in the workplace. And like I said, women's wellness networks, it doesn't cost you anything. If you have a group of very, very enthusiastic individuals that would like to form their own network and provide their own information and signposting and support, it can only do wonders for your workplace. I'll leave you with this quote. One of the greatest underappreciated sources of innovation and new businesses may be, in fact, women over 50 with new ideas, lots of life ahead of them, and with the verve to get it done. Thank you. So we'll take some questions now, if anybody has any questions.
That's great, Emma and Dr. Anise, thank you so much. Really, really interesting session. We actually haven't had any questions put in advance, but we do have a few minutes left. So if anybody would like to ask a question, I think I can unmute everybody. I just have to try and figure out how to do that. Just bear with me 1 second. Or you can also just type them into the question box. Attendees who can talk. Okay, I think this is unmuting. There we go. So that should have unmuted, or certainly given you the option to unmute yourselves now. So yeah, if anyone would like to ask a question. Bear in mind, I think you still, although I've given you the option to unmute yourselves, I think you still have to individually unmute if you do want to do it that way. So if anyone has any questions at all for Emma or for Anise?
If there's no questions, what are people doing for International Women's Day for their Choose to Challenge, if they're doing anything?
That's a good one. I think we're still muted. Someone, so Janet Neal's just said, I just want to say thank you for an excellent session and love the last quote, being over 50. That's great. Jane Hill has said, thank you for the webinar, excellent and really valuable information. Apologies, I have to leave now. So the slides, I think the webinar itself is recorded and will be available via the sort of dashboard. I'm not sure about the slides. Are we able to make the slides available, Emma?
Yes, I can make mine available. Do you? It's up to everybody's individual preference. So I'll speak to Dr. Anise after this, and we'll see what we can put together. I think you're muted, Anise.
Oh
no, you're not now. Yeah.
Can you see? Yeah. Can you hear me?
Yes.
Yeah. No, I'm happy to share the slides as well. Yeah. If more people can access it, that's good. Raise awareness.
Great. And Dorothy McRobb is also
question.
No, surprisingly. I think it was a very thorough presentation. You covered loads of really interesting points and some useful pointers as well. So, yeah, Dorothy.
I think it's interesting.
Sorry, just a couple more people saying thank you.
Oh, that the government thing that came out yesterday about calling for more focus and awareness on women's health. I've only skim read it, but I can't see that menopause is actually identified. Whether I've missed it, I can't even see the word in it.
They want women, and there's going to be some sort of form that you can submit, and they want women, all women, to be honest, I think anyone can do it, not just women, but all women to submit their thoughts on how women's health should be improved. So I think they've deliberately kept it as broad as possible. So some women will focus on the hormone illnesses that I talked about, the hormone imbalances. Some women will be talking about menopause and perimenopause. So I think they left it open deliberately. And I think when they get their responses, they'll be able to identify which areas are considered the biggest problem, and they're going to have roundtable discussions. And I mean, I've offered to help in any way I can with that, because they need women on those panels. They need women who understand this, you know. So I hope it's just not a whole load of middle-aged men. No offense to any men who are watching, but you know, this is a problem with when, you know, things are trying to be addressed, that sometimes the people who are going to be best placed to, you know, brainstorm and troubleshoot and take it forward aren't always the people who are actually involved. So this is everybody's opportunity to get involved. So I think that'll be a very positive thing.
Great.
Okay.
We have got a question actually that's coming from Catherine Ty. She says, what are the best resources for learning about menopause and bone health and cardiovascular health?
Resources. So there's lots of resources on the British Menopause Society website, and the Women's Health Concerns website, which is the patient arm of the British Menopause Society. Really, really excellent. Obviously, I know I'm biased, but my book has everything about cardiovascular risk. There's a whole chapter on bone health, and sort of disease prevention all the way through my toolkit. So my book does have everything in it. But in terms of online, the British Menopause Society, I would say in the UK is the best resource, because it constantly has new information about what's happening with medications, the latest research. It publishes position statements from all the international menopause societies. So I'd say that would be the first port of call.
Great.
Thank you.
And if
Can you hear me a minute?
yeah,
I just wanted to say, really, as an occupational health practitioner, and a woman in her late 40s, we really miss this opportunity when we're doing sort of cardiovascular health education, to make sure that those, you know, that's a real risk age group for people in their 50s, women in their 50s, to have things like heart attacks and that. And I wonder how much of these are hormone related sometimes, as opposed to, you know, poor diet and lifestyle related.
well, it's all intermingled, isn't it?
It's all intermingled. So, and again, every single woman is going to be different. So, you know, there's certain things like earlier menopause can put you at greater risk if you've got a family history, if you've got high cholesterol or high blood pressure, or you're carrying excess weight. There's different factors, and they're all intermingled. If you have a difficult menopause and you can't exercise, you're more likely to gain weight. So it's very difficult to unravel. And I think I agree with you that it's an opportunity that could potentially be missed. And my passion, and that's why I'm glad that the government are looking at least into how women's health can be improved, is that there are several opportunities through a woman's life to actually give her information and to actually highlight and identify any increased risk. So when women go through for their smears as they get into their, you know, 40s, for example, there's opportunities again and again, I think, potentially that are missed, where women could be educated, told what symptoms they might expect, what, you know, checked out for things like blood pressure and cholesterol, you know, risk factors. Bone health is another important one, because as we're living longer, bone fractures are a big problem in older women postmenopausally. So I think there are a lot of missed opportunities, and I think that's what we need to identify and brainstorm about, because actually what we need to do to improve women's health, it doesn't have to cost a lot of money. Actually, we talk a lot in the NHS about better care at lower cost, and if you're preventing problems, you're going to be saving, you know, healthcare resources, and you're going to be saving quality of life and well-being in a big cohort of people. So, I mean, I totally agree with you, and I think this is what I think. It's all changing, and I think it's being recognised, but it all does take time. But I think we're going in the right direction.
Yeah, I agree. The thing I like that you mentioned in particular is around the importance of the individual's responsibility, and so much is lacking in education, and I'm just thinking personally as much as anything else, you know, but as you say, it's that tailoring to the individual need.
Yeah, and if you don't know what to do, you can't do it.
Absolutely, you know, but actually people are willing, if they're bite-sized chunks and they can potentially see the benefit for them, about what may make a difference, what may not make a difference, you know, what sort of short term, medium term, you know, things like bone health really are the medium and the long term for women because they're living longer, etc. So it's fascinating, really. Sorry, Emma, I interrupted you.
No, I was going to relate it to occupational health. So yes, as clinicians, our occupational health clinicians have a unique role. We've got 1 foot in corporate world and 1 foot in health, and we have to serve both areas. And for me, my work started in this because of my case management and seeing women in their early 40s and being diagnosed with work-related stress. And actually what ended up with 2 cases was severe perimenopausal. And so I trained under the British Menopause Society as a menopause specialist and also as a CBT specialist. However, you don't have to go and do all those courses as an occupational health practitioner. You can introduce the menopause rating scale, which is a universal tool. And it's like a tool that a bit like PH9 or GADS, whatever, PHQ or GADS. And so it's the menopause rating scale. You Google it and it gives you all the evidence base behind and how to use it. And it is just questions. The woman fills it in. And what I always suggest is they use that as the benchmark to go to a GP, because if they have 10 to 12 minutes to discuss a whole host of symptoms that's affecting their brains, their bones, or whatever, it is very hard for a GP to start unpicking it. So it gives the woman a voice, and once she looks at it and she can start to map out her symptoms, a light goes on. It dawns on her that actually my frequent UTIs or my stiff hips in the morning or my itchy skin at night actually all might be woman's health, reproductive health. So as occupational health clinicians, we are at a perfect opportunity for the signposting moments for how much exercise do you leak when you run, how are you, all those questions that we don't do a gender specific case management. You might, I'm not, I'm talking about my experience as a case manager for years. And so having the knowledge and where to signpost would benefit women, would greatly, because we massively influence mental health in the workplace. Occupational health was key as that. So I think we should be key as part of reproductive health as well.
So I am gender specific in my work. My problem is that most of my customers are male. So are there any specific resources out there that sort of men can tactfully give to the women in their lives, be them their children, the elders, whoever it may be?
Well, like Dr. Anita just said, the Women's Health Concern is the patient arm of British Menopause Society. And there are brilliant leaflet after leaflet after leaflet on migraines, HRT, complementary therapy. So I also work in workplace wellbeing for a construction firm. So you can imagine it's all, it's quite male orientated. However, the menopause sessions are brilliant because the men are actually suffering and not getting a lot of sleep and not understanding their partners, not recognizing their partners feel helpless. So the menopause sessions have been attended, but that's taken a lot of time of communication to get the right message across for them to come.
Yeah, no, thank you for that. I'll look at those, because I have a lot of men in that, whose wives are in that sort of late 40s, 50s, early 60s sort of age range, if you like. So that's useful, thank you.
It affects the men as well, absolutely. All women's health issues affect, because women have partners, brothers, friends who are men. So yeah, thanks for the questions.
Great. Well, thank you. There's no more questions have come in, and we have gone a little bit over time. So unless there's anyone else desperate to ask a question, I think probably just remains for me to say thanks very much, Emma and Dr. Anise. Again, really, really interesting session, and so glad we could do it on International Women's Day.
Yes, yeah.
So thanks again, everybody. Sorry.
Thank you. We're just saying thank you for having us.
That's a pleasure. Great. Okay, so few thanks coming in via the questions and the chat. So yeah, thanks very much for attending, everybody, and the recording will be available, I think, in a few hours. So okay, I'll close the session now, but thanks again, everybody. Bye.